I feel like I do have additional insight about breast augmentation because I not only am a female surgeon with breasts, but I've had my own breast augmentation. I have had some of the problems that patients can have after surgery. I decided to get breast augmentation because I didn't fill out my shirts, and now there are some shirts I have that I can't button because the implant size that was chosen was just a little too large for my frame. So I feel like having had that procedure and being a woman does give me insight into some of the issues that women face with implants based on clothing styles, going to the gym and needing to move around and work out that male surgeons just may not be exposed to or think about during the surgical process. I think the most important factor for picking the right implant is to know what you want ahead of time. So I want patients to think very carefully about the types of clothing they want to wear after, how much cleavage they want, how much size increase they want, and then also to bring pictures in so that I can very clearly see what you do and don't like about a result. From there, I take breast measurements and use those to come up with a range of implant sizes that will work for that patient. And then we have them try on sizers in the office, and based on which end of the size range they like, then we can start discussing different profiles or sizes of implants more specifically. And then the final decision is made in the operating room with temporary sizing implants so that I can try them on and see if I can match that picture as best as possible. Breast implant surgery normally goes very smoothly for patients, and most patients have an awesome experience, but there are some things that can go wrong after surgery. In the immediate post-op period, patients are more familiar with those types of complications like bleeding and infection, but it's really the long-term complications that many patients aren't aware of. Capsular contracture can happen, and that's abnormal scar tissue forming around the implant, and you can get a very high, tight look, kind of two cut grapefruits glued to the chest. That can sometimes happen with capsular contracture. Also, if too large an implant is chosen, the implant can descend below the normal fold of the breast, and that leads to a deformity called double bubble, where you see the bottom of the breast and then you see another bubble where the bottom of the implant is. There can also be complications like symastia, where the normal separation between the breasts is violated, so the breasts actually have no normal separation. I heard a story about one patient who could actually transpose her implants from side to side and flip-flop them because there was no normal separation. So patients don't often realize these can happen, and it's important to pick a surgeon who not only will do things safely the first time to prevent these, but someone who could also potentially manage them if they happen. Revision surgery, I think patients need to understand, is much more complicated than a first-time breast aug. If you had a 45-minute surgery for your original augmentation, it could take up to 3 hours to fix a complication from that surgery. And one of the best forms we have to help fix things like that is the artificial dermal matrices that are out, or slings. They're also called allografts. And they can really help rebuild anatomic boundaries that have been lost. They can help thicken the tissues to cover issues like rippling or stretch and sag in the lower pole. So that has really revolutionized the way we do revision breast surgery.